Good evening, everybody. Welcome to the March 2nd, 2021 Board of Health meeting. The time is 6:03 p.m. Sorry, reading at a distance here. This agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. I know everybody here is familiar with our setting, but anybody else who's watching, as we are being televised live from WACA-TV here in Ashland. So thank you, Connor. All right, anybody on the meeting for citizens participation? Mark Tassoni?
Good evening, Mark Tassoni. How are you all?
Good, thank you, Mark.
Thank you.
How are you?
I just like to say I'm a happy camper around my house here. Me and my dad both have not been vaccinated. Both have not got hit by the virus, and getting ready for either the Merck Johnson or Johnson or Moderna to come around the door for us. I know you're gonna be doing COVID updated.
Yep, that's going to be next, Mark.
Yeah, and I also wanted to say that it's good to have in this, at least in this Metro West area, that Johnson & Johnson arrived in the Tufts Medical hospitals. That's the closest we got so far, and I just wanted to say thank you for that. Thank you for the government to get that going, the companies. And I know you have the COVID decks, and down the road, one or two agenda items. There's an award presentation going on, so I'll put myself on mute and stay away from that.
Thank you, Mark. Hi, Barbara.
Hi,
We
Barbara.
just started.
Diane, I wanted to make a small statement, if that's okay.
Sure.
Sure.
Just, I mean, I'm assuming
That's the one that I was about. Yeah, that's the one that I had asked you about.
Okay, are you doing it as a resident or is it a soft topic?
It's fine. I can do it as a resident. Doesn't
Oh,
matter.
whatever.
So
I don't know what you're going to say, so just.
that's why it doesn't make any difference which way I say it, but it's okay. I'll use this option as that one.
Okay.
Thank you for accommodating me. I appreciate it. I'm sure this topic has nothing to do with the actions we take as a board members of the Board of Health. You're all aware that we have been living in a different environment on account of this deadly virus. As of today, we have, in the United States, have lost about 515,000 lives due to COVID-19. This loss has disrupted the lives of surviving members and their family, as young as newborn babies and as old as the grandparents. And it's from coast to coast. Humanity in all of us calls us to at least observe a minute of silence in memory of the loved ones, and we have lost their lives, who have lost their lives. May I take the liberty to ask you to lead us through a minute of silence, if you don't mind, please?
Absolutely.
Thank you. Thank you, Dan.
Thank you. Thank you, KG.
You're welcome.
Thanks, KG.
Okay, moving along, Sergeant Berman, also known as Ed. If you want to give us a COVID-19 update, that would be awesome. Thank you.
All right, so hi everyone. So I kind of got a lot going on. Just a little history. When the state released the vaccine for first responders, we initially applied as a town to do our own police and firefighters. We were denied the request. And when I spoke to DPH, they asked us to form a partnership because DPH was not releasing any vaccine to any municipality that had less than 200. So we formed a partnership with Sherburne, Hopkinton, Westboro, Northboro, Southboro, and I'm sorry, one more town. Regardless. So the first responder vaccines were done in Westboro at the Doubletree. It was a very successful clinic. They did all 5 towns over a 2-day period. And then last week, the same first responders went back for their second dose. In the meantime, we had been applying to DPH on a weekly basis to run our own clinics for the over 75 people when that was released. Again, we were denied vaccine. And after discussions with DPH that I had, they told me that we needed to stay in that same partnership that we had originally formed for the first responders. So, not last week, the week before, we were part of that collaborative, and we were able to administer a little over 1,000 doses of Pfizer to our over 75 population. And then in the middle of our clinics, the 4 days that were scheduled, the state released, they had changed it where it could be over 65. So we were able on the last day to get some people that were over 65 in. Mike, if, a guesstimate out of the 1,000 doses, we probably did 350, maybe to 375 Ashland residents. We were also able to administer 4 doses to some homebound people with the help of John Brovelli from the fire department. He went and did 4 homebound seniors that could not get out of their houses. So with that being said, the second doses are going to be this week. And it starts on Friday and then Monday, Tuesday, the 11th is the last day. I don't remember the exact dates. It's Friday and then the 11th, and I think it's the 7th or 8th. But all those people that got their first dose have been contacted. They have their appointments, and that will also be at the Hopkinton Senior Center. Then, so now we've got this really effective collaboration. It's being led by the health director in Northborough. She's phenomenal. We sent all the town managers met, all the board people met, firefighters, fire chiefs all met on a Zoom. A formal proposal was drafted to DPH, and now the collaboration has technically right now been denied because they still want to push everybody to these mass vaccination sites. We had a call today at 1:15 with the assistant commissioner from DPH. We fine-tuned our proposal because we told her we would be able to administer at a minimum 750 to 1,000 doses a week. Having this collaboration, we've actually already secured the DoubleTree Hotel in Westboro, because one of the requirements is that you have to have easy access off highways. So that facility has already been secured by the fire chief in Westboro. And then Northborough has money to hire a vaccine, quote, coordinator. So how we thought would be the coordinator would be handling every day. And then between the 5 towns, I would be there, for example, on Mondays. The Westboro Board of Health Director would be there on Tuesdays. So the proposal is back in again, and we just keep pushing. All of our state reps from all the communities have been notified. They've all sent letters on our behalf. For us, obviously, it's been Karen Spilker and Jack Lewis. They've sent off those letters. And then in the other communities where they have some other reps, those letters have been sent off also. So we are pushing. We're trying the best we can. Any questions on that before? It's been a lot.
Except I think all of these people who got immunization are being logged into the MIS system the state has. And can you extract some data and then put it on there saying that how many Ashlanders?
Sure.
So that as you keep updating the numbers every week, you can do that also. That'll be nice.
Sure. Just so you know, I did run those numbers, KG. As of this past Friday, it's about 17% of our over 75 have been vaccinated. And as a community as a whole, we're at about 10%.
Okay. So,
And that includes some of those people from phase 1, and that is running the data out of the MIIS system.
right. Yeah. You must have gotten 2 more. We got it anyway.
So that's kind of the immunization front. Again, it's very frustrating. And then today at the DPH phone call today at 3 o'clock, they're talking, the main part of the conversation was about how do we handle the remainder of our homebound residents. So DPH came out today with very specific criteria on what they deem as a homebound. So that is going, based on their current criteria, a lot of people that thought they were homebound will no longer be considered homebound. So there's 2 options. Option 1, we as a community can maybe hope we get enough vaccine and then be able to go out and do it on our own, or we're going to be able to sign on for the state to do it. So it sounds like they're going to be contracting potentially with a couple of ambulance services. There's going to be an 800 phone number set up for homebound people. They'll go through a series of questions to see if they qualify. And if they do, their appointment will be scheduled through this 800 service. That is going online March 14th. So again, I'll be working with Joanne Duffy at the Senior Center on what's the best option for Ashland to do on that.
So we need to make sure that the seniors who have not gotten it, who assume that they are homebound and they will get the service, need to know that they are not going to get it.
So
those who are assuming it to be who are not qualified under these. So
right, we'll make those calls, KG. So Mike Herbert, a couple weeks ago, you probably all know, we did the reverse call. We have a list of about 800 people that want us to contact them for different scenarios. And one of the questions that we had asked in the survey when they go online was, are you homebound? So we can definitely identify those people.
Okay, so that's
all right.
Good.
And we used that list when we got the vaccine for the Hopkinton Clinic. That's how we got those people. And obviously, as you know, a lot of people, the state system was not easy for a lot of people. So myself, I really have to thank myself. Bob made some calls for us. Ron made some calls when we found out we were getting some vaccine. We had some people that didn't have computer access, and all the staff up at the community center. We spent, I would say, 3 or 4 days just making appointments for these people, in the prep mod system. So, and I think it went really well. I mean, took a few minutes. You did prep mod a couple of times, and again, thanks Ron and Barbara for helping with that on I think, was that Sunday or Saturday?
It was Saturday.
Yeah, Saturday.
You had called me. By the time I called you back, you said everything was done.
Yeah, we called. I think, oh my God, I think that if I remember correctly, that day I made 198 calls.
Right.
And what's the chances? Because I know I've heard a lot about CVS or Walgreens getting it. I mean, I know CVS is doing testing.
So our CVS in Ashland right now is only designated as a test site. I did meet with I did talk to the nurse practitioner there. They have not been deemed a vaccination site yet. It's other, like the one, I don't know how they've picked it, but like the one in Wayland, it's very random which of those pharmacies have the vaccine and which ones don't. Obviously the demand right now, the demand is more than what we have for vaccine supplies right now.
Barbara, did you have a question? I know Barbara's trying to get in.
Yes, I do. I just had a quick question because I've had a few people asking, like, if they still need the vaccine, how do they get registered? Where do they go?
So right now they have to go to the mass.gov website. So it's vaxfinder.mass.gov. And what I've been telling people, I found a little trick on the website. Don't put in your zip code. There's a checkbox, and if you check that box and hit search, it'll only show you the locations around the state that have vaccine available. Then you can hit schedule. Don't put your zip code in. If you do, you end up in like this nightmare.
Oh yeah.
Yeah, because that's what people were complaining, that they put in all their information and then at the end it still tells them no appointments available.
Correct.
Yeah. So literally, don't put a zip code in. There's a checkbox and it says search for only locations that have availability. Now, when I looked today, earlier today, the only site that had appointments available was Gillette, and there weren't that many. I mean, it was like 50. Again, because there's just not enough vaccine yet.
If they don't have a computer access, they should call 211.
211, correct. And if they're a senior, if you're someone that's really struggling, they can certainly call me or the community center. And Joanne Duffy has people up there that are helping people try to get them appointments.
Or the COVID hotline as well, right?
Or the COVID hotline, yep. So I don't want to give you, so let's talk about the schools real quick, everybody. So as you know, the governor and the DESE commissioner want K through 5 back in school full starting on April 5th. I've been working with Jim Adams and with Audrey LaCroix every day for the last few days, trying to come up with a testing plan and, what the classrooms are going to look like, about quarantining if we have a positive case. So the town just got approved, or the school department, I should say, got approved for pool testing. So we're going to work through those logistics, and I'll be helping with that pool testing in the schools.
Ignorant, but what is pool testing?
So what pool testing is, so let's say you've got a classroom, let's say you have a elementary classroom of 20 people. We'll just use that as a round number. Take 10 of those people, two separate groups of 10. They all get swabbed, and all the samples go into one collection container, basically. Okay, all 10 go in there. So from that classroom, instead of 20 tests being run, you're only running 2. Now, if one of those packages of 10 is positive, now we individually test those 10 people to find out who your positive person is.
What's the purpose behind that?
Instead of the lab trying to run 20 tests, they're running 2. So you're getting your results back much quicker. Okay, and it's more cost effective also.
Okay.
Isn't there a instant testing nowadays available? You can't do that.
So what we're going to do, so we're also going to have the Binex Now test in the schools, which is an antigen test. And yes, we will have that, but that's if we have a student or a staff member that becomes symptomatic.
Okay.
Is that different from what you currently have, Ed?
So we have the same thing, but we have PCR testing in my office for staff. Okay,
so they're going to have a different testing.
We'll still test the staff member.
Okay,
but if a student, if the student will get the Binex Now at the school, the nurses will have that.
Okay.
Yep. Again, we just got notified this morning that we've been selected as one of the communities that's going to have it. So next couple of days, we're going to just work out all the logistics on that.
Thank you for your efforts, Ed.
All right.
Thank you for your effort. The other question I have is related to last week. I was watching the news and there was some statement about Boston School had some issues with missing students, and they had various disparity between different communities, the Black, Asians, and the white. Do we know any of those statistics in our school? Can we get some of those things to make sure it becomes not a big problem? Because students being in the class, either online or offline or whatever that happens, it's their well-being in the long run. So that's important for us to know.
Yeah, so, KG, I think we do a great job. For example, KG, and one of the things that we really learned through COVID and when we've done our contact tracing, remember, when we call families or call individuals that are positive, we don't just check on the positive person. We check on all their contacts, but we also, it's not just quick bang boom, we ask them other questions. We find out, do they have enough food, right? We've referred people to the food pantry, AJ, I'm sorry, KG. we've had scenarios where we found that we've had whole households that are now positive. Obviously, they can't go to the supermarket. So, Joanne Duffy and her team, we've delivered food.
Okay.
We've found out people that have needed rental assistance. We found out people that needed fuel assistance. So I think we as a town, we do a great job checking on the well-being, not just because you have COVID. We check to see if there's any other services that you might need.
Right. That's good. It's a great job.
Ed, just another question for you. And again, it might be obvious to other people, but not to me. So that's for K through 12. What about K through 5? And what about 6 through 12?
So, yeah, we don't have the dates, what the mandate's going to be for them to go back full yet. And I know Jim Adams is working on some stuff, but right now the DESE commissioner wants K through 5 in by April 5th.
Okay, so
but parents will
probably be later.
Yeah, parents. So any parent will have the option of, so in the K through 5 model, since we're hybrid now, that is not going to be an option. The two options are going to be your child goes back full-time or they become an all remote student completely. So again, and that's the school department's handling all of that. Yeah. All right.
Take a breath.
There's been a lot going on. There's been a lot.
Well, I was gonna say, I don't know if you have anything, but anybody else, other board members have any questions for Ed where he's at now, or everybody? Okay. Do you have more you want to give updates?
Just real quick, I don't know if any of you saw, I'm sure Chris probably knows about it. Last week, I did a presentation for Mass Bay, an evening session about how Ashland's handled COVID. I went through Maven and, how we again, the contact tracing, we talked about, MIIS, and it was an educational opportunity for anybody that either a staff member or a student from Mass Bay could have attended. I don't know, Chris, if you heard anything.
I did. I was invited to go, and I just didn't have the time to go. But you are a local hero to people outside of our town for sure for doing that. So thank you.
You should put that presentation on our website somehow. Sorry,
Yeah.
Chris.
The question I had is more in relation to the governor's mandates being lifted, and I have serious concerns in particular about restaurants. As much as I sympathize with restaurants and what they've endured during this last year, in particular the ones that didn't survive, but the ones that are out there fighting to stay alive now are going to be at full capacity, or allowed to be at full capacity, but they do have to maintain proper social distancing and either have 6 feet between tables or chairs, or proper I can't think of the word, partitions.
Shield.
So my question is, are we equipped to make sure that they're going to be adhering to that?
Oh yeah, absolutely, Chris. And it's funny. We went out. My wife and I went out for dinner the other night, and it's funny. The restaurants obviously are not as full as they normally were anyway, and and I think our restaurants in Ashland have really done a great job, especially being on. If they have any questions or concerns, they know they can call me. I get calls every day, with questions and. And I actually, I think you're going to see on your own that they're going to keep their capacity limits.
Okay.
I think you're going to actually see that them doing it on their own because it's become more manageable for them.
Yeah.
Like I said, I think we've done a great job with our businesses.
I agree.
Well, I was just going to say, even with that said, Chris, I think it segues into the same thing with outdoor seating, because at least hopefully the nicer weather is right around the corner. So at least the places who had it that couldn't keep it because of the cold weather, I know that the town's working to hopefully work with them to make that possible. So that would, that's a good benefit as well.
And I think Laura may have sent board that collaboration that went to the state letter. If not, I'll have Laura send that to everybody tomorrow, just so you kind of see what we've been doing.
Is it the updated letter you're talking about, or the one that you sent last week with recommendation from the senators and the
It was the letter written by Kristen Black.
Yeah, I think we got that.
yeah.
Yeah.
Yeah, okay.
We got
Perfect.
I was gonna say, we got, I think that last week.
Laura has
Okay.
been keeping up very well.
Okay, I just want to make sure. So now you know, just so you understand what that collaboration's all
Yeah.
about.
Yeah.
Right. Well, thank you, Ed.
You're
I know,
welcome.
I know it's been a lot for everybody. We were discussing that earlier. It's been a lot for everybody, but once again, we appreciate your efforts and the same thing, Laura, for you too, keeping us, there's a lot that comes in. So thank you for forwarding everything to us and
Yeah.
keeping us.
Not only forwarding, she's summarizing it.
I did
That's
know
what's
that,
in-
Casey, and I
yes.
do appreciate you referencing that. Yes. So
Yes,
thank
yes,
you, Laura, for,
that's important. I don't have to scan through it
yes.
unless
So,
I find an interesting element that I need to look at it. So I'll look at it. Yeah.
So, Ed, I assume you're going to stay on the meeting for a little
Yeah,
bit.
Stan. Yep.
Okay. So if nobody has any other questions for Ed, we'll move along. Everybody else set? Okay. Just give me a nod. Move on, Diane. Okay, the next item on the agenda, which is probably a good segue, is the Mary Mortensen Public Health Award of 2021. I know Laura sent out the concept to the board, but I'll read it for the record just so we have it. So annually, this is what the concept is each year the Ashland Board of Health will honor an Ashland citizen or organization for efforts concerning public health, named after and honoring, sorry, it chokes me up when I read this, so I apologize. Named after and honoring a longtime Ashland Board of Health member, Mary Penny Mortensen. It's awarded a yearly plaque ceremony presentation to the honoree during the first meeting of the Ashland Board of Health in March. So I think it's a good segue because I know we've all had a different kind of a year for the past 12 months almost. So obviously we put it on the agenda. We're a little bit behind, so I apologize. I'll own that. But I think what we need to do is we need to come up with recommendations and obviously discuss it and vote on it. And then what we did last year, just to bring Barbara up to speed, I don't know if you were watching our meetings then, but what we did last year is because we were doing everything virtually, we honored the decisions at every turn last year. So we kind of put it off for a little bit. We were hoping things would open up when we could do a presentation in person. But anyhow, we presented them with, we have a plaque in front of the Board of Health office. So we presented it virtually with their name on it with the year. So it was a nice recognition for all the work that they do for the residents and children of Ashland. So with that said, I actually had spoken to Ed today, and I'd like to go around individually, and hopefully people have thought about this. I spoke to Ed today just to make sure I had the proper terminology for it, and I thought that would be appropriate for us to name the recipient the Ashland COVID response team this year, which is not an individual. That is a group effort, including us all sitting here. And of course, it includes Ed or Sergeant Berman. And Ed could probably explain further, but that also does include the school nurses, the nurses who have worked, whether they're paid or volunteer. That includes the hospital for their efforts in helping us. That includes everybody who has put in all the effort in the last year. So that's what I personally came up with. We could discuss my recommendation, but I mean, I will pass it off to Chris if anybody else wants to go along. And
I'm fine with it. Only thing it would be need to remove our board membership from that unofficially because we don't want to award ourselves.
Well, it is unofficial, but I think honestly, I think we should, and I'll toot our own horn. I think we all deserve a little bit of recognition. We've all worked really hard over the last year. Of course, nobody's here is getting a paycheck for it. There's no, we're not breaking any laws by being included in a team effort. I do understand your concern because some of us we've all been involved with the response. Again, I'm open to other people, other board members' suggestions. If
I'm fine with that.
Let's go. Just Chris, why don't you go ahead?
Yeah, I want to first start by saying I'm completely fine with that suggestion. It's a very good suggestion, but I do I do want to express that I've spent a lot of time thinking about this. And I think, reflecting on this insane, just completely insane year, and how everybody and so many people have stepped up to the plate in so many different ways. But there was one individual for me that reminded me of a time I was in the Boston Public Garden, and there was a guy with, who called himself the one-man band. He had a guitar and the drums and all this kind of stuff. And he was just making all this stuff happen. It was kind of central location for all this music was coming out. It was just one guy coming out. And I thought about, the ringmaster of making all this happen. And I couldn't see a more fitting person to receive this award than Ed Berman. As much as we've all done so much, without Ed, we would just not be where we are today. His skills and his thoughtfulness, his logistics, and his skill set have just completely kept Ashland on the map. So I wanted to say that, and my personal nomination would be for Ed Berman, but I would support the entire COVID response team. I just want to make sure that Ed gets the recognition that I think he really deserves.
And I agree with you, and Ed and I have this conversation probably daily. My only concern is that because that's his job, is I didn't know. I mean, it's tough because you're sitting here and you're in my right eyeball here. Yeah. But I just didn't know that was my concern, is because it is his actual job.
And I've thought of that too. And part of me thought about, well, yeah, he is certainly doing his job, but I don't think anyone that looks at the job that Ed has done wouldn't say that he's gone extremely above the extent of what his job description would say, beyond what words can even describe. So yeah, that's just my personal opinion. But again, I completely support the concept of the team, of the COVID response team getting it all, because it gives Ed the recognition and gives everyone else recognition. But I just personally believe
that's
that.
Okay. Hey, listen, I respect that as well.
I know that I would have said the same thing with Ed, because he has been there 7/24. I send him a text. I send him a text message on the subject. He responds immediately. So
I don't want to skip over. I don't want to skip over Ron. I just want to go on. I'm sorry.
Definitely.
I just want to go to Ron. Sorry, KG.
No, that's fine. I mean, initially, I would think it was an individual Ed, but, I'm sure Ed would be, too modest to say, why not give it to everybody? Although I completely agree with Chris and KG and you as well, Diane, that, if there's one person, it's definitely Ed. I think he did go well above and beyond, staying up, late at nights, doing stuff on weekends, running around to all the different restaurants to make sure that they're COVID compliant. It's been more than just a regular 40-hour work week, but I also completely agree with KG and Chris. I'm fine to give it to everybody. It would be tough to slight anybody, but it's also tough not to see Ed honored for just really a superior job that he's done for us. So I'll go either way, really.
If we do the group thing, Ed's font got to be a little bit bigger than everybody else's.
Now, well, I'll make a suggestion that let him receive it on behalf of the team, because he is going to be in the building, and you can present it right there virtually.
Well, I was going to say that. I said, no matter what, Ed's going to be on the meeting, no matter what. So, Barbara, again, I know you're new to the board, but you've been involved for a while. So, do you have any recommendations, or would you like to put your 2 cents, so to speak, in?
I think Ed will be good for the short time that I've heard from the short time that I've been with you guys, and that I've heard all the information. I've worked with him on a few things, and like KG said, you text him, he texts you right back. Sometimes it's like he calls you back and you be like, oh, I missed the call, and you call him and he answers immediately. So I truly think he has exceeded his job. Like you said, it's his job, but I think we all know that he has done more than just his job. And yes, I understand it's a group effort, but they have to have somebody who really is putting more of their time to go back and forth. So I think I do agree with everything, the time that we're in these days, to say, you know, the COVID group to say is the correct one to go for at this time, because they've done a lot for our town, and we all know it could have been worse.
So I think Ed and I speak every day, and, you know, I know it's probably embarrassing for him that we're sitting here talking about how good of a job he did, but I do agree with the board members. I think that Ed has led the charge, so to speak, and has done an awesome job. It's been a year. It's been very challenging on all of us, and I think he's kept us all afloat, between the school, police, fire, town, and now with 5 or 11 other communities. He's been.
And Diane, over and above the COVID work that Ed has done, we have that software that we're using now. Ed spearheaded that, right? The software for the restaurant inspections.
Food inspections.
Right? That didn't have to happen. When Ed goes into these restaurants for a COVID inspection and sees other problems, we all get a call 10 minutes later, hey, we got a problem with this place, we got to shut them down, all that kind of stuff, over and above every step of the way. Just
I know
I've
it's
just
strange, but I'm speechless. I don't look at
Yeah.
that. You even
It's unbelievable effort that's just so over and above what everybody else has done.
Well,
for me, and even the hardest workers. So
and I agree with you again. I personally work with him every day and see him running up and down the hallways. So I do concur. So with that said, it sounds like all the board members are potentially in agreement. So if somebody wants to make a motion for the honoree of the Mary Mortensen Public Health Award for 2021, I will be glad to accept a motion.
So moved, the team.
Do I hear a second?
Second.
All in favor?
Aye,
Hi,
KG.
Chris.
Hi, Diane. Congratulations,
Hi,
Ed.
Thank you, everybody.
well-
Thank you. It's very appreciated.
We, again,
Great
we
job.
do appreciate everything you've done for us over the year, but we will have a official ceremony in a couple of weeks at our meeting.
Why don't you have that Zoom meeting in your office and have Ed there in the office?
Absolutely, KG.
Why can't we give him why can't you personally hand over for the team?
Listen, I could do that.
Yeah.
And we can certainly give an honorable mention to every other member of the
Sure.
COVID response team.
Yeah.
Yeah.
Right. Because everyone, I could not do it all without everybody helping and everybody being on the same page, and I really need to give a shout out to, especially the school nurses. You guys, when I need them, they are right there. And I really also, Joanne Duffy's group up at the community center, when I needed help with calls and stuff, everybody just jumped right in whenever I needed any help.
Yeah.
And I hope I didn't miss anybody.
Well, I was gonna say, I think that's why it is hard, because we don't want to miss anybody, but I mean, it is well deserved, Ed. I mean, you've worked really hard, and don't stop now, please.
Right.
I
Take it
won't.
right back.
I know.
That plaque ain't engraved yet.
No, thanks again. You embarrassed me, but thanks again. And
I knew that
I'll
it would be uncomfortable.
I'll save you guys one late night phone
yeah.
call.
Well, and again, just to add to that is because Ed and I had a conversation today, and he knew where I was going with this conversation about him being recognized. And we discussed it, and we, you know, I wanted to make sure, because again, I know he said the same thing, there's a lot of other people, so we discussed the title of who would cover everybody. So I wasn't not trying to give Ed the recognition, he just wanted to give it to other people because that's what Ed does. So it is good that the board had a unanimous vote, and I do appreciate that.
So, excuse me, but is the unanimous vote for, how is it going to be worded? Is it Ed or the team?
Ed.
Okay.
Oh, and
Sergeant
and
Ed
Laura.
Berman.
I was
And
just
Laura.
gonna say, it's actually, it will
And Laura.
actually be
Okay.
proper to be Sergeant Ed Berman.
Sergeant Ed Berman on the plaque.
Correct.
Okay.
And we have to definitely recognize Laura, because
Oh,
she's
thank
fielding
you.
hundreds of phone calls a day
Laura,
about the
yeah.
vaccine.
Mhm.
And by the way, I do want to, I do also want to publicly thank Laura. Laura graciously volunteered 2 days up at the vaccine clinic, helping people set up their second appointments. And
Hey, save all your thank yous for your speech.
I know, no, but just, Laura came up for two afternoons, and it was a
I
lot
talked
of
there.
work.
Yep.
It was a lot of work.
But it was a very well-run clinic, because I did take my mom
Yes.
to it. It was a very well-run clinic, and a lot of happy people running it. So that was
A lot of
Yeah.
happy people.
They were happy that Ed was there.
All right, so we're gonna move on. Again, I know I talked to the board before about having items on the consent agenda. If you don't mind, I personally want to pull off the medical reserve corps and the director's position I'm gonna leave because we don't really have an update. But I do want to talk specifically about the medical reserve corps.
Can I just ask
Yeah.
a quick question about the
Yeah.
health agent position, Diane?
Of course, let me just actually, if we can, I apologize, you guys. I think we should talk about the IMA Medical Reserve Corps and the health agent position. So therefore, the consent agenda would just be for the budget and the three sets of minutes. Is everybody all set with those items?
Yep.
And then the other three will pull out? Okay, can I have a motion to move the
So
consent
moved.
agenda for those three items?
Second.
Sorry, just one, just one thing. Not that it really matters, but if for correctness sake, I think Laura put that I didn't agree to adjourn the meetings. I think it was probably just from up above.
Oh,
Does that matter?
which sets it? No, I'll fix that.
Well, if you wanted to stay
It's
on.
yeah, I know. I'm usually not opposed to ending them either. So it was just.
I
It was
want to
just on
stay.
the
We
two,
have to
like,
keep the
ending
meeting going. I don't want to adjourn.
All right.
Was it all three sets, Ron?
No, it was just on the, I think it was the second set, Laura, at the end.
Uh,
I have it right here.
I think there were kind of like two that were back to back. I think you almost repeated it, but it just said, I think it was to adjourn the meeting.
It probably was a template.
Yeah.
was it the ones from the joint meeting?
It could have
There's
been
one
that.
that says 4, but that's because we only had 4 members. Is that what?
That was the one that we had only 4.
Yeah, but
No,
it-
only
it
3
says-
members there.
Yeah, it says,
Chris was not there in that meeting
Oh,
either.
January 20th.
it says no a couple of times, like, about adjourning the meeting. It probably was with everybody.
You were
Okay,
eating your
that's fine.
stew.
Okay, I didn't.
So I don't
didn't
know
do those
how
minutes.
it needs to be, but I would accept them. And if you
You
wanna
didn't do
change
those,
the
Laura?
time, you don't, that's fine.
Susan did. I kind of put our heading on the top. And-
Okay, I'm sorry. Okay, yeah. Okay, so that's January 20th. So Ron did vote yes to adjourn the meeting. So we'll,
Just for completeness
well,
sake.
no, we want to make
I'll
sure it's
change-
correct.
Yeah, so just, make the motion with the amendment.
Yeah,
So that,
okay,
Do I hear a second?
yeah.
Chris, second?
Yeah.
Oh, okay, all in favor?
aye.
Aye, Chris.
Aye, Diane.
Aye, Barbara.
Okay. So again, I apologize because I just wanted to update the board on the IMA. And again, I'm not sure, Barbara, if you're familiar with it, but We have been working with the city of Framingham, Hudson, Holliston. That's it.
Wasn't
with the-
Sherburne in there, or am I mistaken?
No, it
Oh,
was,
no, Sherburne's Ed's thing.
right, exactly.
Wasn't Holliston was one of those towns.
Holliston, Hudson, Ashland,
Framingham.
and Framingham.
Mhm.
So we have agreed upon the Board of Health, as well as the Select Board, have agreed upon the agreement with having a shared nursing service with the city of Framingham. They're going to be the lead agency. I just wanted to let the board know that I do have a meeting with them Thursday afternoon, just to kind of regroup. Again, things have been a little hectic with everybody. Framingham has lost their director as well. He has left the city of Framingham. So we are getting together. They're saying that there's no changes since the change of management, but we are going to regroup on Thursday afternoon to get an update and just make sure nothing has changed. So we're still moving forward with the agreement. So I just wanted to make sure I kept the board in the loop. Any questions for me on that? Okay. The other item I wanted to talk about is the Medical Reserve Corps. You may have seen that Roberta Ho, who is our regional coordinator, sent out an email to all active members that they need to, excuse me, give an update, that they need to go on to the I think it's mass response, if I remember correctly. Mass response. I just want to say that I know that I've been very passionate about the Medical Reserve Corps. I don't feel that I've made too much headway with it. I am still passionate. I am still working towards getting more volunteers. I hope all of you will, even Chris with getting off the board in May, will enroll and become, active leaders in this, because of what we've dealt with this last year. We really do need active volunteer members, whether you're in the medical profession or administrative profession. We have about, I think it was 16 the last time I checked, 16 active members. So if we had to have a clinic, or God forbid there's a disaster here in town, if we had to call on our members for assistance. I know we all know people and people are willing to help us, but I think if we could possibly spread the word to get some more recruitment from the Medical Reserve Corps. This latest change in people enrolling in the mass system, I did it myself. It was challenging. They run background checks, which I know that they did before, but it's just the whole system was a little overwhelming, and I'm afraid we're going to lose a couple of members with it. So the current members need to enroll in that system by the end of March. So Roberta will keep reminding the active members to do that. But if you could help me, and again, I will try to keep this as an active item on the agenda, not on a consent, that we promote the Medical Reserve Corps for our volunteers. Again, just to reiterate, it's not all medical. It's, if you have administrative skills, we do need people in different level and skill sets to help us. So with that said, I don't know if anybody has any questions on that.
Yeah, what I suggest is that if you can put a one-page line on how to get in there and how to register, all the ABCDs of what to do with it, that would help, so that it can boost people to do. Because last time I tried to do it, I've still not registered, so I didn't get any information as such.
So this new system, the email that Roberta sent out is actually, Chris, the new email that Roberta sent out, it does tell you how to actually go through and what to do.
Okay, I'll take a look at that.
Yeah, take a peek at it, and because if there's any other suggestions, or again, even the same thing in 2 weeks, if you say, hey, I did it. I'll
circulate
people.
Yeah, I'll circulate that list around for people to use it to.
Great. Yeah, I just think that I would like to promote and try to get more people active on our Medical Reserve.
Definitely.
So I just want, and again, I apologize. I'll keep that as an active item so we can promote it each meeting. And then the other thing Chris mentioned as well is the Board of Health agent director position. I'll start by saying that currently we did have an applicant who went through, Chris knows, Chris was in the interview, went through a second round of interviews, was offered the position, signed the acceptance, and unfortunately, at the last minute, he did pull out of the position. It left us in a little bit of a tough situation, but we're Ashland, we're strong, right? So, so we have a couple other interested candidates. I know Jen is working on interviews, you know, looking at resumes and so forth. So it is very active again. So we, it was a little frustrating because I think, you know, it was a long process. So I was very hopeful. So, so Chris, do you have anything else you wanted to add to that?
Yeah, just that, yeah. I mean, I was in on the interview with the person that made the offer, and there were some concerns, and oddly enough, I kind of thought what would happen happened. But if it's any consolation, and it's not based on the person itself, it's based on my perception of what I saw from the interview and the history, I don't think it would have been a good fit.
Okay.
Long term.
And again, I think, you know, I
Yeah.
did not sit on
Yeah.
either
Yeah.
interview committee, so I just met the person in general passing. So
Yeah. Perfectly nice person, but I
yeah.
don't think long term. I think that it's as painful as it is to have to go more time without someone and to have to go through a process that fails. In my experience, which is pretty vast now with searches, a failed search, as painful as it is it fails for a reason.
Well, and I'm hoping when I'm assuming you're going to still sit on the second interview as well. I'm hoping that it's a learning curve for everybody.
Yeah.
You know, so it's unfortunate, but we are where we are. So hopefully, again, I believe there's a couple candidates that have applied. So we'll hopefully be seeing that in the future as well. Excuse me. So if nobody has any questions for that, we'll move on to topics for the next Board of Health meeting.
Yeah, I had a question on what's happening with this dollar store. So there seems to be lagging behind putting it back in shape. Tom Curran had gone a couple of times on that. Are we going to get that? I think it's the dollar store or $1 store.
Family Dollar, the place
Family
next to
Dollar,
CVS.
Family Dollar, yeah.
So Tom did call me because I did express the same concern you did, KG, about calling him in front of the board. He, I think we all know Tom well enough. He felt that they responded a little slow, but they responded quickly when they did respond, and didn't feel that they needed to be brought in front of the board.
I thought I read it as if the upper management was reluctant to do things. So maybe they needed a boost by bringing them here and telling them. I thought maybe.
Well, quite frankly, I would support Tom going in there literally every day and finding him every single day.
Correct.
Well, I agree with you. And because I had sent an email to Tom asking him if he was available as well, inviting the manager as well as the regional manager or district director to a meeting to discuss this. As we all know, he did give them a fine, and he said that it got their attention. So he said they're very responsive. From what I understand, just to give a quick overview, I guess they've had have reduced hours like crazy. I don't know if it's from sales are down or whatever the case may be. So they were definitely lacking. So again, I'm just going by what he's telling me. I told him to keep us up to date, and he said that they have responded and have taken care of everything. One thing I did have, you probably see on the agenda for the next meeting, and I apologize, Olivia, you're probably not watching our meeting, but there's a woman in Framingham who is our, let me back up a little bit, I apologize. So when Mark Warren was on the Board of Health, he got into a regional tobacco control district with the city of Framingham and other communities. My ignorance, I don't recall ever talking about it. Maybe we were aware of it and it slipped my mind. So it was brought to our attention when Mark retired from Ashland, and since then, Jen Ball, the assistant town manager, and I have had a couple of correspondence with Olivia, and again, I apologize, I do not recall her last name. She is the person in the city of Framingham who's in charge of the region, the program. She wanted to come, unfortunately, because she couldn't make it tonight. She wanted to come and give us an update on what the program is, where they're at, where the state's at. One thing I can tell you that I do want her to let the board know directly, which is coming directly from the state, is the state is not pushing for compliance checks right now.
Hmm.
So, and just to let you know, we need to bring our tobacco regulations up to the state standards. The last round that we did, we fined $300. Apparently the state changed their regs. I'll own it. I didn't know. We were supposed to update our regulations. The fine, the first violation notice now is $1,000, which again, I understand we all want a harsh penalty, but in today's times, I was like $1,000. That's just a lot. Here nor there, we can't argue about it. There's nothing we can do. We need to change our regulations. So I'm in the process of working with them so we can change our regulations, have them come to our next meeting, give us an update on the program, let us know where the state's going with compliance checks and so forth. And we will also be appointing her as our agent because she's our regional agent. So it's kind of a quick overview, but we will have her personally on our agenda, our meeting next meeting to give us an update on the actual program. And they have the same thing. It's kind of like the medical reserve Corps. They have different levels that they need to meet and so forth. So I want to make sure.
Doesn't the state regulations override ours all the time?
The state regulations.
Yeah. So even if you don't change it, it's still the state regulation will apply.
We still need to update our regulations to bring them.
Okay.
You know, we need to
compliance with it. Yeah.
Yeah, we need to update them. And again, as far as I know, that's the only thing we have to update is our fining, our violation notices.
Yeah, maybe we should publicize it and do it next meeting.
Well, yeah, and again, I want her to come in front of us and give an update.
Okay.
And so I want to make sure because the program was new to me, new to the town. So, and again, it might have been something we got an update a long time ago and it slipped mine or our minds, but it was brought to our attention. So I just want to make sure that we're all on the same page.
At least initiated discussion, and when she comes in, we can initiate a discussion after.
Yeah, and we don't, I mean, in technical, I mean, we do need to, just because of past practice, we do advertise it.
Right.
So I figured if we have her here, in 2 weeks, we can set the advertisement dates and so forth, and then we can do a so to speak, a presentation like this for the public on the new fining system and go through the process like we've done in the past with our regulations and kind of follow the procedure, even though it's And again, if just please, I mean, Chris, I know you worked very hard at these. If there's anything that I didn't recall that we needed to update, just please let me know and we'll make sure we get that in as well.
Mm-hmm.
I think
I'll review them
is
again.
all set.
I'll take a quick scan of them.
Okay, all right. So again, for the next meeting, we're going to have the tobacco control program agent on. We will do the Mary Mortensen award presentation. I will have the IMA with the city of Framingham. I will leave that as an active item, medical reserve corps, and hopefully we have a Board of Health agent director position update as well. So I'll put a couple of those items on under mine to make sure I keep them active.
It's on 18th of, no.
I didn't look at it.
The 17th March, yeah. Today is what, 16 March.
Yep. And again, with that said, I mean, we have a meeting March 16th. My plan was not to meet 3 times this month, just the way that the month fall. If everybody's okay with that, meet the 16th and then go to.
Yeah, but if there is anything
first
emergency,
and third is what we always do.
I just want to make sure everybody was on the.
Right, but if something comes up, we can always meet an emergency if there
Yep.
need be. So not a problem. So that's fine. That's good.
So March 16th is the next meeting at 6 p.m. I'll just go right around. Chris, do you have anything else that you can think of for the next meeting?
No, I think you covered it.
Okay, Ron, you're in the corner now.
Just to follow up with the new fining system, are the 16 licensees, are they specifically notified? Because just like you said, that's a hefty fine. I would think that we should probably at least let them know. Not that that should change anything. They shouldn't be selling whether it's a $300 or $1,000 fine, but I agree that that's certainly going to get somebody's attention.
Right. So my thought is when Olivia comes to the meeting in 2 weeks, that we would talk to her, introduce ourselves. She can introduce herself, run over the program, and then we can set I'll call it a hearing date, but I apologize, a public discussion to talk about the fining. We'll notify all of our establishments as well as the public. Hold on one second, KG.
Sure.
Go through the process like we will, and then we'll change the regulations, sign the regulations, and then everybody will get a copy like we did in the past.
Okay.
But I figured that we should have her come in front of us and give us an update on the program and just make sure there's nothing else that we need to update, because I want to make sure she reviews them and gives us any.
If I'm not mistaken, and I could be, I can't remember because I haven't read them in a little while. I think, do we still have the actual numbers in the thing, or do we just say maximum allowed by state? I can't remember if we changed it.
The finding system itself.
Yeah.
I know that the last round of compliance checks we did was $300 fine, and it was supposed to be 1,000. So I'm not sure if the whole fining structure is incorrect or if it's just the beginning fine.
Yeah, what I'm trying to say is that, to Ron's point, and I agree with Ron, your point is well taken.
Right now,
but if right now the state wants us to fine $1,000 and we wait 2 weeks to have this presentation and then do a hearing and stuff like that, somewhere between now and then someone may make a violation and we'd have to fine them $1,000, and they may think it's only $300. So it wouldn't be the worst thing in the world if we could just verify that it is in fact $1,000, what those numbers are, and just shoot an email to all the licensees to let them know that the state has changed their fines and we're in the process of changing the paperwork, and we'll have a meeting or discussion. But you should know that as of now, the fine is this based on the state figures.
Yeah, in the same connection, I was wondering if this presentation is coming up on the next meeting, why can't we send them a notice saying there's a presentation coming, which may be helpful for you to understand more. And then if you want to join, please come in. Or let them come and then enjoy the meeting.
Well, that I think we should do once we set, because we're still going to go through the process. And again, this is my assumption. I haven't talked to council. I mean, I haven't had this happen in my position here, is if the state's laws supersede ours, is it a given, or do we have to physically go through the process like we've been through? I mean, what I can do tomorrow is I'll check with town council. This is all kind of just coming fast, if you will. So I'll check with her, because maybe we don't need to actually go through the process, and exactly next week, 2 weeks, we can just send out the notice, this is it, and that's it. I mean, I'll check with council on how we do that. And maybe, yeah, I agree.
Even though if it says in the book, I think it does say that the state regulations supersede in most of the cases, and the regulations do carry it. I agree with Chris that if somebody violates now, and then if you have to charge them $1,000 fine, they'll be shocked.
Yeah.
And
well,
so
let's put it this way. And again, I don't want to. Let's put it this way: we did not increase the last fine.
Mm-hmm.
That's all. So I'm just trying to pull it up. I don't know. Go ahead, Chris.
I pulled up what I think is a fairly recent copy of the regulations that we've edited, and it looks like the 300, 500, 1,000 are in there numerically.
I will check with council today, and if the state law supersedes and we don't need to physically do anything to our regulations, because I know there are language in there, KG, I agree with you, there's language in there. If there's something that we just need to do it at the next meeting, we can do that. So I'll check with her tomorrow, and I'll send an email to the board tomorrow. As long as I get the answer.
And it may not hurt sending them that there is a discussion coming up for general explanation that whatever presentation is coming from this lady here. You can invite them as specifically that you may be interested in, if you want to come in, and they can just attend
Well,
it.
she's coming in to talk to us about the program that we have as a region, not what we're doing for the residents. So in general, normally when we make a regulation change, we notify all of our vendors and then set a date for a public discussion.
Right, but there isn't a chance that we are now going to talk about this regulation.
Well, we don't know yet. We don't know yet
on that day.
We don't know if we're going to have that.
Yeah.
Okay.
Laura, I'm sorry. Diane, you finish.
I was just going to say, I just don't know if town council tells us, well, the state law supersedes you.
Mm-hmm.
You don't need to have a public discussion. I agree with you. We'll let them know.
Yeah.
This is what we're doing, and we'll just send out a notification.
Yeah, usually the public discussion is if we're changing the regulations of the town. Like when we added the vaping stuff, that was new. That was something that we chose to enforce as a town. So that's something that requires
which the finding would fall into that.
Right. Yeah. Laura, could you send me a copy of the regulations as we have them on file as the official copy? Yeah, this way, because I have probably 15 different variations of it. I want to make sure
right.
I'm working for the same one.
Yeah, and
in
if
the
we
right
don't
one.
need to have a public discussion and notify everybody,
Mhm.
you know, properly, then we can just notify them, but I'll check with council tomorrow.
Okay.
All right. Anybody else have anything for the next meeting?
None. So may I have the pleasure of proposing an adjournment at this moment, please?
I'll second it.
I'll second it.
Thank you.
It has been double seconded.
Wait a minute, you should have let Ron. You should have let Ron.
That's right. Let's get that
Yeah,
documented.
no, I don't agree with that.
Ron's like, I'm voting no. All
Who
in
wants to eat the
favor?
rest of his soup on camera?
Aye.
Diane, aye.
Okay.
Aye.
Yeah, aye.
Chris.
Have a good few
All
weeks.
right, everybody. Good to see
All right.
everybody. Have a good
Bye-bye.
night.
Good night,
Bye-bye.
everybody.
Good night.
Yeah.
Thank
Good
you.
night.
Bye-bye.